Did you know that around 1,400 new cases of ovarian cancer are diagnosed each year in Australia? And unfortunately, there is no early detection test for ovarian cancer, so all women need to know their bodies and be aware of the symptoms. Like all forms of cancer, early detection is key. So joining us to discuss ovarian cancer and the symptoms is the wonderful Dr. Elizabeth Jackson. So let's start first with, what is ovarian cancer?
So ovarian cancer is a type of malignancy that arises in the actual ovaries, although there's now emerging evidence that a lot of the ovarian cancers actually start off in the tubes, so in the fallopian tubes.
Oh, wow. Interesting. So what are the different types then of ovarian cancer? Because that sort of whole system is quite...
Yeah, there are actually dozens and dozens of different types of cancers, and it's because if you think about the ovaries make eggs, and the egg of the human body, when paired with sperm, creates a little embryo which has the potential to turn into any cell of the human body. So there are so many different types of ovarian cancer, but the most common type is epithelial ovarian cancer, and you've got serous ovarian cancers, and you have some glandular type of cancers as well on the ovaries too. You can have dermoid ovarian cancers, and the ovaries may also be a site of metastases of cancer travelling from somewhere else in the body and through the bloodstream or through the lymphatic drainage make their way to the ovaries.
So one of the most difficult things about this type of cancer is that there are often no obvious signs. And that location doesn't actually allow for anyone to sort of check them out or self-examine or anything like that, like our breasts and other areas. So what are some of the symptoms then that we should be looking out for?
Yeah, they can be quite subtle. If you are, say for example, a woman in your 40s or 50s and you have sudden onset of irritable bowel type symptoms, that may actually be a sign of something occurring at the level of the ovaries. So you would see your GP, who would hopefully arrange perhaps an internal ultrasound scan. And if there is a lesion on the ovary, they would pair that with a blood test. Other signs of ovarian cancer can occasionally include a persisting or enlarging known ovarian cyst, or it can include pain down below. Very occasionally you might get abnormal bleeding patterns associated with that. But some women, when the malignancy has progressed, may have the first symptoms being weight loss, abdominal bloating or swelling, and also changes in appetite, so a real loss of appetite paired with a loss of weight.
And what are the causes? Because obviously,
Yeah, look, sometimes it's genetic. So you have women such as Angelina Jolie. So she had a BRCA, so an ovarian cancer gene. So there are known genetic causes. So BRCA is one of them. But also sometimes it's a little bit of bad luck. Other times it can be age-related. There's an association between breast and ovarian cancers. You can also have lifestyle measures which increase your probability. So examples of that include being a smoker. That tends to increase your risks of these sorts of things as well. There are, though, some more subtle things. I'm sure over the next few years we'll get more answers, but it's a tricky one to pick, ovarian cancer.
So is there anything that we can do to reduce our risk? Obviously quitting smoking if you're a smoker right now. Anything else?
Yeah, so definitely stopping smoking, maintaining a healthy weight and lifestyle. There is some evidence about being on the pill reducing your ovarian cancer risk, and having completed your family, if you opted for a surgical sterilisation procedure, removal of the tubes can reduce your lifetime ovarian cancer risk. Some women that have known genetic conditions may opt for a completion procedure where they actually have a oophorectomy, so removal of their ovaries, to minimise their risk of getting an ovarian cancer as well. So those are the basic ones.
And what about treatment? So obviously if you do get ovarian cancer, what's the treatment like?
Yeah, so increasingly actually chemotherapy is a really, really big component of treatment, and there's also a role for excisional surgery, so removal of your tubes and ovaries. If you have an ovarian cancer, that'll commonly also include removal of the uterus and cervix with a total hysterectomy. But the ovarian cancer, in addition to chemotherapy and surgery, sometimes radiation is utilised as well, and you can sometimes have the chemotherapy first, and then surgery, and then further chemotherapy. So it's very unique, everybody's management for ovarian cancer. So when it's diagnosed, a really big team of experts comes together, and that's called a multidisciplinary team. And they hold these meetings where there's, dozens of doctors that include your gynecologist or gyne-oncologist, your oncologist, radiation doctors, you'll have cancer nurses present, you'll have radiologists present, you'll have pathologists present, and for every woman that has an ovarian cancer, this team of expert meets, and they meet in each of the hospitals where they treat ovarian cancer. They meet regularly, either weekly or fortnightly, to determine for each patient what is the recommendation of all of those experts coming together to stage the cancer and treat the cancer.
So if you're worried about symptoms or you've been diagnosed with ovarian cancer, come and see the team from Birds of Paradise. They would love to help you on this journey.